Diabetes is a lifelong condition, and type 2 diabetes is a progressive condition. This means that treatment regimes will change over time. Your diabetes specialist will advise if and when you need to change any medication. Throughout your life, however, some ways to control your diabetes will not change. Blood glucose monitoring should be part of your daily routine. Blood glucose meters are a reliable way of monitoring your diabetes at home. There are several different meters available in the UK. You should be provided with a meter by your diabetes specialist who will show you how to use it. Depending on your individual circumstances, your diabetes specialist will advise you when to test your blood glucose. Sometimes it is useful to test before meals. Other times it is useful to test 2 hours after meals. The frequency of tests will depend on your treatment regime and your diabetes control. Testing your blood can help you understand how different foods and activities alter your blood glucose. It will help you make informed decisions about how to react to everyday events. For people without diabetes, the normal range of blood sugar is between 4 and 7.8 millimoles per litre. With all treatments for diabetes, the aim is to keep the blood glucose as near to this range as possible. We usually recommend your blood glucose tests at home should be between 4 and 9 millimoles per litre at all times. If you have a European or American meter, the range is 72 to 160 milligrams per decilitre. You should write the results of the tests in a diary and bring the diary or your meter every time you see your diabetes specialist. This will help guide your diabetes treatment and management. When testing your blood glucose, you should remember to wash and dry your hands thoroughly before you start. Check that the strips are not out of date or that the pot has not been opened for too long. Prick the side of your finger, not the middle. Try to avoid using your thumb or forefinger for testing. Record the results in your diary. Dispose of needles and strips safely. The first step to controlling your diabetes should be to look at what you are eating. A dietitian or diabetes specialist will give you individual advice on how to do this. Any changes that you need to make should be made by your whole family so that you can all eat healthily together. Don't forget to eat at least 5 portions of fruit or vegetable per day in these changes. Exercise is also an important part of your diabetes treatment and should be part of your daily routine. You should aim to do the recommended amount of 30 minutes of exercise on at least 5 days per week, combined with 10,000 steps per day if not restricted by disability. There are several different medicines for type 2 diabetes. They can be classified into these groups. Metformin. Metformin works by making your body use insulin more efficiently and by suppressing the liver from releasing glucose during the night. Metformin is often the first tablet prescribed to people with type 2 diabetes. Sulfonylureas. This is a group of medicines which help the pancreas to produce more insulin. This group of tablets includes gliclazide, glibenclamide, glimepiride, and glipizide. These tablets can cause hypoglycemia if the dose is too high. Metaglinides. These tablets are taken before each meal and help the pancreas produce more insulin for a short duration. They are called repaglinide or nataglinide. Glitazones. Rosiglitazone and pioglitazone are the tablets in this group. They can be taken at any time of the day and make your cells more sensitive to the insulin already in the body. Acarbose. Acarbose should be taken with the first mouthful of food at each meal. It works by slowing down the absorption of glucose from the meal. If you have type 1 diabetes or have type 2 diabetes, which cannot be well controlled with tablets, you will need to take insulin injections. There are several different types of insulin and insulin pens, along with different types of regime, depending on your circumstances. In type 1 diabetes, a basal bolus regime is ideal. This involves two different types of insulin. One is the basal insulin taken once a day. The other is taken with each meal containing carbohydrates. This usually involves 4 to 5 injections per day. The dose you take with each meal should be varied, depending on the amount of carbohydrate eaten. This should balance the blood glucose readings so that the level is always between 4 and 9 millimoles per litre. Some people may use insulin via a pump system if they prefer. In type 2 diabetes, various regimes are used. The regime that you use will depend on individual circumstances. Some people will use the basal bolus regime. Others will use a twice-daily regime using mixed insulin. Twice-daily insulin injections are usually given before breakfast and the evening meal. This regime is good for people who lead a regular lifestyle. Some people will have once-daily injections with tablets. This regime is good as an introduction to insulin injections and for people who need a simple regime. Your diabetes specialist will suggest a regime that will suit your lifestyle. They may recommend that you take tablets as well as the insulin. You will be taught how to give the injections, where to put the injections, and how to use the pen device. When using insulin and blood glucose testing, you should dispose of the needles and lancets safely. Your GP should provide you with a needle clipping device and a sharp spin for safe disposal of needles.